Hello there. Today I'm going to be doing a 7 weeks on testosterone update, which probably sounds like a weird number, but I've actually seen other trans guys and various people taking testosterone do like 7 week updates, so I wonder if like it's kind of normal to have some stuff to write home about. But yeah, obviously I'm dressed a little more femme today. Clothes do not equal gender, my dudes, and also a big part of me choosing to transition is that I want it to be easier for the people in my life and for the queer people that I meet who are attentive to gender me correctly, regardless of what I'm wearing. And also, I've literally always wanted those changes ever since I found out you could get them. So, yeah. 7 weeks yesterday. My follow up appointment to check how things are going is February 21st. Today is either January 31st or February 1st, I'm not sure. But it's almost February. So I'm coming up on getting my levels checked and possibly dosage adjustment. I'm still doing bi weekly injections. I'm not sure how I feel about that anymore because I'm going to talk about some negatives. Um, but yeah, I also don't think my voice is deeper. I think I've just started talking lower um, because I don't look like this every day. This was for filming today, and I actually have been presenting as masculine as I can tolerate, which is um, still very femboy. But also, yes, I have a gaming chair. I'm working on getting my PC set up, but my CPU is stuck in shipment hell. So, um, basically, I just wanted to talk about anxiety and also thermoregulation, um, heat flashes, because I've basically, like, I'm feeling better now, but I had to re-record this because last time I recorded it, like, I clearly was still, like, freaking out of it. And I basically just wanted to talk about how, like, it sucks. Like, like, going on hormones, like, it sucks at some point or another, and it might happen to you sooner or later. I knew that from my history, most likely, testosterone was going to give me pretty severe anxiety at some point, just even going through the massive changes, if not something hormonal inside of me. Because I literally, last time I went to the mental hospital for a panic attack that was putting me at risk of myself, I had been on birth control for a month. So I was going through hormonal changes. So I knew that I was setting myself up for possibly a difficult time. I didn't expect it to hit me at 6.5 weeks though. So basically, I had a panic attack one morning. I was extremely stressed out. I had a lot going on, which involves me moving my bed out of here and into my living room. And now I have a full like filming space, and this can eventually be a streaming room, which is cool. But I had a lot going on. I was also working 9 days in a row, and I've been figuring out my nutrition to help me build muscle and feel good, but it's hard to navigate that kind of thing with a history of an eating disorder and stay sane about it. So it's a very touch and go sort of thing where I try to learn some things and then put it down for a while. But I was very, very stressed out, and what should have just been a really bad morning after a horrible night's sleep, that wasn't my fault. I'm so passive aggressive right now. I had a panic attack, and I had an anxiety episode that lasted about 5 or 6 days, and I had to take my as needed medication. And if I did not take my as needed medication, that's more powerful than my daily, I probably would have had to set up an emergency psych appointment, or who knows what would have happened. Last year, I learned the hard way that like I'm prescribed these harder medications for a reason. I have a diagnosis that gives me a right to these medications, and not only is it okay for me to take them, I need to take them preventatively when I specifically am in a panic episode, because your daily anxiety management skills don't work when you are in fight or flight mode. You have to approach it differently. You have to approach it with a sense of acceptance and patience. So, I really recommend Therapy in a Nutshell's videos if you relate to panic attacks and severe anxiety episodes. But I knew once I got into that state, it was going to take me about a week to feel better. But as I started to feel better, I noticed that I was boiling hot to the touch all the time. and I have been really cold the past couple of years, probably because I have kind of gone in and out of a healthy weight range. I was really, really warm to the touch. Sorry, I'm checking my time. I'm good. I was really warm to the touch as a teenager. People would always say I was like a little heater. Um, but I've been really cold the past couple of years and cold all the time. All of a sudden, I was just, and it just rapidly increased over a couple of days. Really, really hot, pretty hungry too, which made my anxiety a little bit worse because I've kind of figured out some things where like being really hungry is linked to literally traumatic memories from my, sorry, my chair is so loud, from being in eating disorder treatment, because I received good medical care, but my psychiatric care was very poorly lacking, and I was left to suffer the worst panic state and anxiety state of my life with no help other than throwing a medication at me that actually made it worse before it made it better. And that's what it does for everyone, and I was not warned that that was going to happen to me. So, makes sense that like the increased hunger and stuff, now I see why that sometimes freaks me out, but like there's a very simple answer to that, and that's just to eat. Shocking, I know. But yeah, as I started to feel better with my anxiety, you know, I with my anxiety I get this sensation that like my arms are on fire sometimes when it's really bad. And then I just noticed it wasn't just that they felt like they were on fire. They were just boiling hot to the touch. It's especially my arms, which makes sense because I work out my arms as hard as I can, and testosterone isn't doing anything yet, so there's not a lot to write home about. It's not that impressive, I know. But there has been, like, despite my weight being up and down lately, like, my forearms, especially here, they are bigger than they have been in, like, years, despite my weight fluctuations, even though I'm not at a very high weight for me right now. So maybe testosterone is doing something with that. Maybe all the training I've done for, like, 7 months is finally catching up to me. I don't know. But yes, very, very hot, and it's actually like difficult to manage, and it makes me very fatigued and tired. And I felt sick, literally, between having, you know, mental health struggles, but really, like, I was hot and I would get like brain foggy and fatigued when it would be at its worst. And I also have had like a lot of like gastrointestinal stuff, probably just from the anxiety. So I literally just felt like I had like I was like on the last day of having the flu, basically, for quite a few days. And I still have moments where I'm kind of embarrassed trying to talk to people because I can't really like form sentences very well because I get so exhausted. I caught myself doing that thing where I would be like not sleepy enough to sleep, especially, you know, when I'm struggling with an anxiety episode. I can only sleep at night, and a lot of times it's very interrupted sleep. But I would catch myself being so exhausted from the heat flashes that I'd be like closing my eyes while watching TV or something, and my eyes would be rolling back in my head. Like, so tired your eyes are rolling in the back of your head. I'm sure plenty of you know what I'm talking about. Like, I know sometimes I do that when I'm sick, like really sick, which I'm like never sick, but when it happens, that's something that happens. So basically, I've learned dress in layers and don't be afraid to be active. Actually, I thought maybe working out was making it worse. No, working out actually helps heat flashes. It helps train your body to regulate your temperature better, and it lowers your core body temperature after you're done. So if working out is safe for you, do it. Also, luckily, it's extremely cold outside, so I'm just like comfortable out there, which is crazy because we have had like a winter storm and shit. So the fact that I'm like chilling out there is like, I've had people like touch my arms and stuff. I'm like, do I feel like boiling hot? And they're like, yeah. So it's not just me. People on Reddit say that it's your like metabolism doing interesting things, but I think right now it's just hormonal flashes because supposedly your metabolism really doesn't change until like 6 to 12 months. But everyone's different. Nothing else to really report other than I can't regulate my body temperature for shit. I'm like hot sitting here just talking. And I got some trans tape, which is tape that is safe and specifically designed to push your chest flesh like back out of the way and into a more masculine shape. I'm not wearing it right now. I'm just very flat chested. which is why trans tape works as well as it does for me. Trans tape is great for all chest sizes, though. I took it off yesterday, had very minimal skin irritation. Actually, I did about 3 full days wear, because you can just wear it until it doesn't work anymore, and then you want to take care of your skin afterwards. I probably could have put some more on today, but I was like, nah, should be safe. Incredible experience. I got to wear a cotton t-shirt to work. Are you kidding me? Without binding? I don't like binding. Binding has a lot of long-term health implications. So does, like, especially improper trans tape wear. Like, the likelihood that I'll get like blisters or skin irritation at some point and have to take a break from it is very likely. But the skin irritation versus like the muscle, what's the word? Like muscle atrophy and stuff that can happen from binders is like 2 whole different levels of shit, in my opinion. So I do want to save up for particularly a hysterectomy, actually. I don't know if it'll be full or partial, probably partial. Even though I have a lot of reproductive cancer in my family, so it would be good to kind of just get rid of everything, honestly. Yes, I know that means I have to be on hormones for the rest of my life of some sort. I accept the consequences, and I also do want to save up for top surgery, but both of those require a lot of time off work, and also having someone close by who can support me, if need be, in person even, and I might have that now, but I don't like to assume, because I have had trouble keeping people in our life, such as life. But right now I'm actually paying off my medical and dental debt. I had a tooth removed like 2 years ago, and then I'm paying off my mental hospital stay from last year. So I want to get caught up on all my medical debt and then save up and then do it. So I probably will not be getting top surgery or a hysterectomy for probably at least 2 or 3 years, if I had to guess. Maybe within 2 years. But now that I've had the experience of having my chest flesh in the proper place, because I don't want a fully flat chest. I want a masculine chest, but I wouldn't want it to be perfectly flat. I like a more built chest, which involves some body fat as well as muscle, for my aesthetics at least. But since I have a pretty small chest, just moving it around into the proper place with tape looked amazing and felt so good. I don't think I can post pictures. I mean, I guess I could. I don't know if I can, maybe. It felt amazing, and I hate how long it takes the tape to dry after a shower. That's a really annoying sensory thing for me, but it's so worth it. Seeing and feeling it in the right place, I'm like, yeah, top surgery's in my future, but not super soon. Yeah, so basically I just wanted to say, yeah, I've opened up about this with my friends, and I've had a lot of friends be like, yo, yeah, I felt really sick for like 3 months. My throat was hurting because of the voice changes. I was hot all the time. I was tired all the time. I literally just felt sick, and it was not glamorous. It wasn't fun. I wasn't just suddenly overnight this like really handsome jacked dude. It's a really uncomfortable process, and especially if you have a history of anxiety and or depression, you're probably gonna go through some shit. And I would have you and your team, whether it's you and a psychiatrist like me, you and a psychiatrist, a therapist, that would be best, or even if it's just you and your family, you and a general practitioner, even that. Have everything ready to go if you need your backup meds, just in case. Like, I'm really grateful my psychiatrist had some foresight and went ahead and ordered me a refill of my as-needed meds last time I saw her, because I told her what, all these changes that I'm going through and stuff, and she was like, oh yeah, just in case, why don't we go ahead and do a refill of that, because you don't have any, do you? And I was like, yeah, I guess. And then literally like 6 days later I had a panic attack. So shouts out her, she is psychic. But anyways, yeah, have yourself ready and get comfortable with being uncomfortable. That's a big part of healing from anxiety and panic, is just being comfortable and not fighting it when you don't feel right, when your body doesn't feel right, when you don't feel good. I've really just been trying to learn to pick and choose my battles and learn how to still have a good time when I don't feel good. And that's a very privileged thing to say, because I have pretty good physical health. And yeah, just, I'm very lucky at the end of the day to feel as good as I do and to have the things that I do. So I've just been trying to focus on that and also just be honest with the people in my life. Sometimes I just need to tell someone that I feel like shit. And that's okay too, because you're going through massive hormone changes and it's going to be a lot. So be patient with yourself and have a beautiful day. And I'm probably going to disable comments. Bye.